Hello, everyone. People are still joining in, but I wanted to first alert you to some of the technical issues, and then we'll have our welcome from CDPHE. Just so you know, the webinar is being recorded, so I know there are some of you who are listening by phone and may not be able to see the slides today. You will be able to access it later, fully recorded on the UC Denver Piper website that's shown here. We have muted all of you at our end, but please also mute your own computers so that you don't have feedback, and don't try to unmute. We will take questions at the end, but you can type them at any time using the chat feature. And so we will collect the questions so you don't have to worry about forgetting it along the way. And if you have any technical issues, please use the chat feature for that as well to let us know, and we will do our best to address them. We do have a technical expert here with us who hopefully can deal with any glitches that arise.
Good afternoon, everybody, and happy St. Patrick's Day. I have to say that because my name is Colleen and I'm Irish. I'm Colleen Capsamalis from the Colorado State Health Department, from the Child Fatality Prevention System, sitting here with the rest of the team, Andy, Kate, and Leah. We wanted to thank you all for joining the webinar today. I know that some of you are coordinators of our local child fatality prevention teams, and we interact with a lot of you, but we have a lot of other participants who are maybe members of child fatality review teams, or other people kind of interested in learning more about how we take a public health approach to injury and violence prevention, and especially how kind of an introduction of how child fatality prevention teams can be used to launch prevention strategies for injury and violence. So today we have a speaker from the Colorado School of Public Health. Her name is Dr. Carol Runyan. Some of you may have met her last spring during our May coordinator training, but for those of you who did not get a chance to meet her, Dr. Runyan is a professor in the Colorado School of Public Health and director of the Program for Injury Prevention, Education, and Research, also known as Piper. Though new to Colorado in the past 5 years, Dr. Runyon has more than 30 years of experience doing research, training, and practice in injury and violence, and has been recognized for her national leadership roles. She works with the Colorado Department of Public Health and Environment on a number of activities related to child fatality. Carol, I will kick it off to you. Thank you for facilitating this webinar today.
Great, thank you, and I'm pleased to see so many people signing on, and I'll dive right in. The title of my talk is Moving Mountains: How You Can Save Lives through Child Injury and Violence Prevention. And I want to explain why I named it that, and refer to a success story of a colleague of mine from many years ago, Jackie Moore, who was at the time with the Indian Health Service in Western North Carolina. And she saw a pattern of injuries coming into the emergency department in her community on the Cherokee Reservation, and saw that there were a lot of people being hit by cars in this one location. She did a pin map. And instead of just saying, well, be careful, watch out for cars, she actually arranged to blast away a part of the mountain. This photograph is not the actual mountain, but I couldn't find that picture, but it looked very much like this, with no sidewalk. And she was able to get a piece of the mountain removed to make a sidewalk that greatly reduced injuries. And I think this is a nice example, as in her own words, a small success in the community can then start to build momentum and help you move forward with larger and larger projects. So I wanted to start with that very hopeful message and encourage you, as I'm going through my talk, to think about similar opportunities in your own communities, even if it's not moving a mountain. What are some things you could do? So I'm going to be talking about different approaches to injury prevention within the context of public health practice, talk about some of the things that you can do in your community and hope to stimulate your own thinking about that, And I see this as background to the upcoming workshops that we will tell you more about at the end. So first, just to put in perspective, the data from the Child Fatality Review System over the last few years and the leading causes of death that are reviewed by your committees are shown here with the numbers. So I'm going to use some of these as examples, but I wanted you to keep in mind these injury problems as you think about the principles that I'm going to share with you today. Now, I'm starting with some assumptions about you as an audience. I'm assuming that some of you are public health professionals, but that some of you come from other fields as well and may be less familiar with public health concepts. I'm also assuming that all of you care about protecting children and making your community safer, or you wouldn't be on a child fatality review team. And I'm also assuming that in whatever role you are in the community, you have a role to play in improving safety. So let's start with talking about some basic assumptions of public health. And I'm going to talk about 5 assumptions and then more in depth on some than on others. The focus in public health is usually on primary prevention, which means to prevent problems before they happen, which we do either by removing hazards and making environments safer, promoting protective factors, and making the safe choice the easy choice. Public health is also population focused and works to solve problems at the whole community level so that everyone is helped at once rather than one person at a time, as is done in more clinical settings. Public health also relies on evidence, uses data to understand and prioritize problems, and you have been looking at your data at the local level to enable you to do that, and I know that there's resources at CDPHE to help you with that. It's also important to draw on evidence from good studies and not just from anecdotes, and to continue to evaluate and improve so that we don't keep making the same mistakes over again. Public health is very multidisciplinary and uses knowledge from a variety of sciences, as well as drawing on expertise from multiple professions, ranging from educators, healthcare professionals, law enforcement, policymakers, all the different kinds of people that you have on your teams. And it's a very action-oriented field and is proactive in taking action to solve problems, either through promoting policies, changing systems, assuring fairness for all, through multiple different channels. And many of you have probably heard public health referred to as moving upstream. And I want to tell you where that comes from. It's a very interesting metaphor that derives actually from a poem, The Ambulance in the Valley, that was written in 1895 by Joseph Malins. And I'm going to read you just the first stanza of that poem, but I encourage you to Google it sometime and read the whole poem. The poem starts off, "'Twas a dangerous cliff, as they freely confessed, though to walk near its crest was so pleasant. But over its terrible edge there had slipped a duke and full many a peasant. The people said something would have to be done, but their projects did not at all tally. Some said, put a fence round the edge of the cliff. Some, an ambulance down in the valley." So while we clearly want to have ambulances in the valley to rescue people who fall into this river off the cliff, public health is about preventing people from falling off that cliff in the first place. So we're looking for opportunities to do the equivalent of putting the fence around the edge of the cliff. So let's talk about some of the factors that affect injury and violence. I'm going to talk about human characteristics of behaviors, products, physical environments, and social environments. And with each one, give you some examples of what that means that are very common examples to you, and then hopefully help you think about how each one of these factors provides an opportunity for intervention and prevention. So looking first at human characteristics and behaviors, we can think about physical factors, like developmental factors with children, things like strength, balance, vision, hearing, size. As these pictures illustrate, on the right-hand side, the small boy, who happened to be my son 30 years ago, and an elderly person. They're both potential at risk for falling, but for very different reasons, and may need different kinds of solutions. And likewise, the child on the left, who's curiously looking into that toilet, is just the age where kids are a little top-heavy and can easily look into a toilet or a large bucket and fall in and drown. So these are examples of where one's physical development and capacity may influence whether an injury occurs. And other aspects of normal development, judgment, curiosity, size. If you're very low to the ground, you're more likely to find that penny and stick it in your mouth and choke than if you're an older child or an adult. The child there looking under the sink is doing very normal behavior, exploring what's in that location. But if those products are poisonous, he's potentially in trouble. And similarly, the girl curiously looking at that gun that was left on the counter should not have access to that. She's doing exactly what children do, which is to experiment and be curious. Similarly, behaviors like risk-taking in adolescence and responding to peer pressure, conforming to peer norms, whether it's drinking or smoking marijuana or driving fast or driving without a seatbelt, those are all behaviors that relate to whether an injury may occur. Unfortunately, changing people is very hard. And while we all believe in education, or we wouldn't be here today, rarely is education aimed at behavior change the best approach, at least by itself. So while we want to do what we can to change behaviors, we also want to work on changing environments, systems, and products, because that's usually a better way to move upstream and put that barrier around the cliff. So let's move on to some examples of things in the product, physical, and social environment domain and how they can be changed. So thinking about different kinds of products, the size of the product, whether it poses a choking hazard for a young child. That's why we have labels, warning labels on, and restrictions on toys for children under 3 or under 5. The quality of the construction, does it break easily such that pieces can fall off and either be swallowed, or that they can cut someone, or that if you're standing on it and it falls over, you can be hurt. If it doesn't work properly, if there are other kinds of safety flaws, those can create problems, and those can all be fixed. If it's hard to use properly, if you can't figure out how to use it, and so maybe you jury-rig it to do a different, to use it in a different way, it can create dangers. That happens sometimes with farming equipment, where people take off the covers and protections on a power takeoff device, and then a child or an adult using it may be caught in it and suffer an amputation. And sometimes the dangers just aren't clear. If something looks like something safe but really isn't, perhaps because of poor labeling, as in this example. And here again is a child engaging in perfectly normal behavior to explore under that sink, which should be locked so she can't get in there. But also look on the right-hand side. These are all cleaning products that look a whole lot like beverages. So there's a problem there. If she does get into those, she won't know, and maybe even an older person wouldn't know that these are not safe to drink. And similarly, as we know with some of the issues around marijuana in our state right now, how they're packaged and they look like other products, or it's not obvious that they contain marijuana, can be dangerous. And we know we're seeing ingestions in young children and overdoses in older people. But products can be redesigned for safety. It used to be that it was very easy for kids to get into pill bottles like this child on the left. And then in 1970, the Poison Prevention Packaging Act was passed, making it a requirement that we have child-proof caps on medicines and other types of hazardous substances. People who have trouble opening them, I'm always asked, people with arthritis who have trouble opening can get a waiver at the pharmacy, but these have made tremendous difference in childhood poisonings. So it's an example of changing the product to make it safer. And we've done this in many ways, over the years. Let me go, see if I can figure out how to go back. So in the 1950s, on the left, this is what car seats look like. Now, I will say that when I was a child in the 1950s, my car seat was my mother's right arm. When she was coming to a quick stop, she would put out her arm. I don't know if this picture is any better than what was there, but look at what we've done over the years. We've improved child passenger safety with car seats and back seat positions and rear facing positions. So we can make a difference through product design. So let's think about things that you could do around products at the local level. And I've just put a couple ideas here to stimulate your thinking, and I'm sure you have many more that you'll want to talk about with your own groups. But maybe you want to think about working with local merchants or agencies to provide free or discounted lock boxes for medications to reduce the issues of opioid poisoning among adolescents or younger children, putting locks on cabinets, putting locks on guns and handing out gun locks. Some localities have done that. Also making sure that car seat installation and inspections are easily accessible, whether it's through the fire department, the health department, the hospital, wherever, and so that people can easily get to them to be sure they have proper fitting car seats and are using them correctly. And you have, I'm sure, many more ideas. Moving on to physical environments as a factor in injury and violence, let's look at some issues there. So one issue is obviously how things are constructed, how clear and visible things are. Think about road signs. If you can't see, in my neighborhood, I know there are trees growing such that sometimes you can't see the stop sign, and that could be fixed. The protection from potential hazards like rails on bridges or along the steep drop-offs in some of our more mountainous areas. The surfacing under playgrounds, and I'll show you an example of that in a moment. But thinking about how can we make changes to the environment, sometimes very simple. Just cutting down a limb in front of a sign makes a big difference. You don't always have to blast away part of the mountain. And constructing things in more durable ways so that they don't deteriorate because of the materials used or the quality of construction. Things like playgrounds or other park facilities or even bridges and roadways. And then ensuring that there's good maintenance, like ice removal on sidewalks. So let's look at a couple of examples. Here's an example of an old-fashioned sliding board, the kind that I had on the playground in my school when I was growing up. Think about a group of 3-year-olds wanting to go down that slide. It looks very enticing. It's steep. It looks like a lot of fun. But think about it. It's over a pretty hard surface. The steps are pretty far apart. A small child could fall through between those steps. There's no guard at the top to keep the person on top from falling off the top once they get there. The sides aren't very high, so you could tip over off of it quite easily and land on that hard surface. And so there are a lot of potential problems, and it's very high. On the other hand, the one on the right side is just as steep, just as fun, I would argue, but it's built into the side of the hill. So if somebody were to fall off, which looks like it would be less likely, they would only fall a few inches onto soft grass and not onto a hard surface. And they can, run around and come up onto the slide without a big staircase that they can fall through. So there's an example of using the environment to your advantage to create safety. And I doubt that it costs a whole lot more. Here's another playground example. The kind of playground I had as a child was more like the one on the left, with hard seats on the swings and a cement base under the swing set. And let me tell you, it's easy to fall off of those seats, and if they whack you in the head when you do fall off, it really hurts. In contrast, over on the right side is a more modern playground with a soft surface. I think this one is either made out of pebbles or perhaps rubber. And swing seats that are soft, that if they hit you in the head won't hurt nearly as much, but also keep you from falling out because they hug you to the inside the seat more easily. Pool fencing. I mean, drowning is an important childhood injury problem, and it's recommended that any pool have four-sided fencing that a small child cannot open and cannot get over, so that we avoid the kind of issue that we see here on the left. And then there's the issue of safe sleep, and the environment of sleep for the child on the left, as we know, can be hazardous. Cute as all those stuffed animals are, that's not a good sleep environment as compared to the one on the right. So let's move on to the social environment and think about social environment factors. There are lots, oops, I'm sorry, I got those out of order. Here's some ideas for physical environment changes at the local level that you might think about. Think about playgrounds and child care center inspections and repairs. There are guidelines put out nationally for playground safety. And you can do inspections and make sure that the facilities in your community are safe. You can work through regulatory processes at the local level to pass ordinances to require safe gun storage in homes with children. Some communities have done that. To require four-sided pool fencing, to identify and fix unsafe pedestrian crossings, provide medication disposal sites so that people have a place to go to dispose of their unused painkillers and just get them out of the house entirely so that no one is tempted to use them recreationally and risk overdose. And then I'm sure, again, you can think of many more ideas. So moving on to the social environment, this is where we think about things like the norms about behavior that permeate a community, the culture of safety in an organization, employment practices. So some examples here, I mean, in the norm area, I mean, what are the norms in your community about safe firearm storage? I mean, forget for a moment about regulation. Just what are the norms that you can help promote so that every family stores their firearms safely, so that not only are the children in that home safe, but when children come to visit, they're safe too. And the norm of asking parents, other parents, about how firearms are stored or how medications are stored before taking your child for a play date, and just creating the norm that it's okay to ask, and that helps encourage the practice. Different kinds of parenting practices and helping each other develop norms and safe parenting practices like how to discipline a child safely. Norms about alcohol use and drinking and driving and designated drivers and the use of car seats. I'm sure you can think of many examples. And these are things that can be developed and nurtured at the community level. There's also, along the same lines, is the nurturing of a culture of safety within an organization, whether it's a daycare facility, a school, or a workplace, where people look out for each other and look out for the whole environment to ensure that it's safe for everyone. And similarly, I know that there are a lot of efforts going on now in Colorado to ensure family-friendly employment practices so that there's accessible, safe childcare available to working parents, that people earn a living wage so that they can afford to get the childcare they need, to purchase a car seat if they need it, to take their child to appropriate playgrounds and have safe toys and so on. And also thinking about paid parental leave, which has been shown in some other states to have a real impact on the incidence of child abuse. Some of these initiatives happen through changes of norms and just encouragement at the local level, and some through social policies, how we regulate alcohol, how we regulate the distribution of opioids, or enforce restrictions on prescriptions, gun storage, childcare availability, and so on. Some of these things can be done without laws and policies, some with laws and policies. So here's just to help you think about child discipline. I think most of us would agree that beating a child with a belt is not a good idea, and that there are other ways to talk to children and keep them in line. And similarly, we all know that shaking a baby is a bad idea. We all know that, but not everybody knows that. And that it's okay to put a crying baby down in a safe place and walk away for a little while, rather than lose your cool. So we can help people learn these skills. And again, safe gun storage can become a norm in the community. So some ideas maybe for working at the local level: encourage or pass ordinances if appropriate in your locale to support and recognize employers who already are using family-friendly practices. Schools and daycare centers that are practicing safe practices or encouraging them to do that. Gun retailers that promote suicide prevention. There are efforts going on in several parts of the state now to encourage gun retailers to have information about crisis services and to be on the lookout for people who are coming to buy guns because they're depressed and thinking about suicide, and to use those retailers to help be part of the solution. And this is catching on in multiple parts of the country. Working on safe medication disposal and having disposal sites and helping people understand the importance of doing that and making it happen at the community level. And making sure that the bars in the community follow drinking age restrictions and aren't serving alcohol to 18-year-olds, and are checking those IDs. Enforcing speed limits and DUI policies, and many, many other things to think about at the local level. So let me talk about some basic principles. One basic principle in public health, or I should say fundamental principles in public health, is, as I said before, behavior is hard to change and to maintain over time. And we just need to be aware of that. It's a very hard thing to do. Not that we should stop trying, but we shouldn't rely on it. We also know that knowing what to do is not sufficient. And I'm going to challenge you all to just think for a moment. We all know that we should floss our teeth every single day, but I'd be willing to bet that there are at least some people in the audience today who didn't do that, including myself. So we know what to do, but sometimes we forget, we get busy, we just don't do it, we don't like to do it, whatever. We need to make, as I said before, the safe choice the easy choice, so that people don't have to struggle. It's the same concept that many of you are familiar in applying to dietary improvements. If the only food available is fast food in a community, then it's hard to expect people to eat more healthy foods. So in the same way that we need to make the healthy choice the easy choice in terms of diet and nutrition, we need to make the safe choice the easy choice to prevent injury, violence, and child fatality. And that means that we change environments and systems wherever possible as our starting point. It isn't always possible, but when we can have a bigger impact more easily. Along with that, I want to encourage you to think really hard about avoiding blaming. And I know when you're faced with a child death, and you, particularly if you see that someone, whether it's a parent, a teacher, whomever, has done something wrong, it's very easy to get into the blame game. But we all do things we shouldn't do, or don't do things that we should, like flossing our teeth. And I think it's more valuable if we envision our task to be one to make the world safe enough so that we can all make mistakes, as we will do, without getting hurt. And along with some of the difficult issues in designing interventions at the community level is the issue of freedom. And people none of us like to have our freedoms restricted. And so we need to think carefully about when we do that and how we balance individual freedoms with building community and ensuring safety for everyone. There are some freedoms that we care about more than others, and I encourage you to think about that. I often say to students when I'm teaching about this in the university here, remind them that every single one of them, when they drove to campus today, and all of you, when you drove to your offices today, your freedom was restricted because you're not allowed in the US to buy a car with glass that shatters. But I would be willing to bet any of you that that's not something you laid awake thinking about last night, that it's not a freedom to buy cars with shattering glass that most people care about or worry about. That's not a freedom they value. Now, if I told you that you couldn't have a firearm, or I told you you had to wear a motorcycle helmet, some people would find that offensive, and those are freedoms that they do value in a different way. So we need to think about what those are, but not all freedoms are the same. And sometimes limiting a little bit of freedom can make a whole lot more safety for the community. And you just need to be able to gauge that for your own community and what's acceptable. But a principle here is also that the less individual effort that's required, the greater the likelihood of success. So the less individual effort, the more the success. And here's an example. Babies get burned in hot bath water if the temperature is too hot, over 120 degrees. Well, we can educate people and encourage them to check the bath water every time they put the baby in the bath. And that is, of course, a good idea. We want to do that. But we could be even more successful if we encourage people to set the setting on their hot water heater at a safe level so that it doesn't come out any hotter than the safe level in the first place. That's what we refer to as a passive intervention. It's built into the system, much like an airbag is built into your car. You don't have to, when you see the semi coming at you, say, oh, I better turn on my airbag so that I'm going to be protected. It's there to protect you when I still wouldn't recommend running into a semi, but it's built into the system. And so to the extent that we can do things that are more of this type, we're going to increase our success. And so just a couple other examples. I mean, to help drive that point home, if you are prescribed medication, say for hypertension, and you have to take lots of pills, and on Tuesdays and Thursdays you take it at this time, and on Monday, Wednesday, Friday you take it at that time, it just increases the opportunity to make mistakes and not get it right. And that's one of the reasons, for example, why the single dose contraceptive medications have been so successful. It doesn't require remembering or getting it wrong, leaving open the chance of getting it wrong. It just takes care of the problem. In the same way, I mean, we can promote positive parenting one parent at a time, but if we establish a social norm and a culture of positive parenting, it just becomes natural and easier, and we don't have to stop and think about it every single time we make a decision. It's not easy, but it's more successful. So reviewing primary prevention in the green are the things we do before a problem occurs. So we change conditions, we change policies that enable or encourage violence or injury prevention. It may be supporting norms and policies that improve safety, or it may be discouraging negative behaviors or negative policies that encourage unsafe or unhealthy behavior. That's distinguished from secondary and tertiary prevention interventions, which are those like the ambulance in the valley after people have fallen off the cliff, where we respond to violence or injury after it occurs, provide services to survivors, and encourage awareness of those services. Now, I want to be really clear that I am not suggesting that we should in any way stop providing secondary and tertiary prevention interventions. They are critically important when people are in need of them. But I want to encourage you to move upstream. And so to move up into that primary prevention realm up here, and to think about activities that are not just directed at individuals, but remember the population focus of public health that has many layers within it, but where we can make changes more at the community or at the sociocultural norm and policy level. That's where our biggest chances of success in preventing child fatality and injuries in general is going to come from. So let me talk just a little bit too. People often talk about the going after high-risk people and high-risk groups and using a very individual perspective. This is what is done, as I said, in clinical settings and in a criminal justice environment, where we ask the question, why did this person get this health problem at this time, or commit this crime, or get into trouble, and how can we improve things for this individual? And it's usually after the fact. And what I'm asking you to do is to think about shifting over to the right side of this slide and think about the population of perspective, where we ask a slightly different question. Why is there more of this health problem in this community? Not why did this person get it and that person didn't, but why do we have more of this in this community, looking at your data, than in another community? And how can we then change things to reduce the amount of the problem in that population or that setting in that community, and serve the whole population rather than one person at a time? That's the public health approach. Or stated another way, a high-risk strategy, just going after people who are at high risk, which is very tempting. Well, let's focus our resources just on those people at highest risk, is a targeted rescue operation for vulnerable individuals. Those are the people already in the river. Instead, what we want to try and move toward, and it doesn't happen overnight, is a population strategy that recognizes that common problems reflect the behavior and circumstances of society as a whole. So if we work at a population level, we can make things better for everyone and not have to just focus on those who have already fallen in that river. So let's look at some examples. So in a high-risk focus area, we would have parenting programs for families referred to Child Protective Services. Now, I'm not saying that's a bad thing to do, but that's different from taking a population approach where we ensure that families have some protections in place, such as, using the example of family medical leave, that helps all of them at the outset through primary prevention and the whole community, and isn't just focused on those who are getting into trouble. There are multiple different approaches we can use to achieve these goals that I've been talking about, and I like to capture them this way. It rhymes nicely. educate, regulate, legislate, and litigate. And I'm just going to give some examples of each. And I want to encourage you that education isn't always just for the person who's at risk, just for the children or even the caregivers and the teachers. We also need to be educating all different kinds of professionals about the principles and about ways that they can prevent injury. And we need to be educating decision makers, whether they're leaders of organizations like school systems or hospitals or health departments, or policymakers at the local or the state level. So we can use education in that way. Sometimes we need to use regulation. And examples are how we regulate toys. And the picture there in the bottom right is showing the hazard warnings that are put on toys to help us protect young children from choking hazards or other types of hazards. We also regulate professional practices and training. You know, how prescribing is done. Do you need to use the prescription drug monitoring program, for example, of the state? What kind of training is required or available for recertification if you're an EMT, or if you're going to counsel someone who might be suicidal? Then, of course, there are legislative or types of regulation, which could be at the local ordinance level, could be at the state level, could be at the federal level. Some of these are focused on changing how individuals behave, such as our laws that require car seats. Some may be focused on the design and availability of products, and the discussion going on in Colorado about marijuana packaging and labeling is that kind of issue. There's also appropriations for how we support services and whether or not we support, say, the prescription drug monitoring program or suicide prevention services or whatever. And then there's potentially legislation that relates to training of providers. Usually people think of litigation as the last resort, but it can be a very powerful tool. Even the threat of litigation can be a very powerful tool, and it's been used in products, particularly like around toy products, but also, as you all know, in issues like workplace safety or medical malpractice. If all else fails, sometimes litigation is the best choice. As you think about programs, I want to remind you again of the importance of evidence-based programs and seeking help from resources, and I'm going to give you a list of resources in a moment, but also, that includes the state health department and university colleagues and others, and get help in deciding what is good. And just because it's clever, glossy, comes in a spiffy package, looks cool, doesn't mean it's good. If it looks too good to be true, just like the old snake oil promotions, it probably is too good to be true, and so you don't believe all the promises. And health fairs, I always like to make a note, health fairs are not evidence-based interventions to reduce injury and violence. If your goal is to help people understand what services are available in a community, it can be a useful activity. But too often I think people are expecting health fairs and handing out widgets, cute as they may be, to be an effective injury prevention or injury and violence prevention intervention. And I would argue they are not, and that your time and energy and resources can be better spent elsewhere. So wrapping up, going forward, I want to remind you that every member of your child fatality team has a role to play. And I would encourage you to start small and start simple, but don't waste time on things that don't have much impact. So work with people who can help you evaluate. Even very simple evaluations can help you figure out if you're on the right track or if you're wasting your time and money, so that you can then stop wasting it and go on to something else. And I think, as with the example, the Jackie Moore example that I started with about the pedestrian safety and moving the mountain in North Carolina, build on those small successes, and that will nurture bigger successes. I want to remind you, child fatality is preventable. We do know how to solve these problems. There are many, many interventions. We can't solve them all at once. That you can't save the child that's already deceased, the cases you're looking at, but you can make a difference for other children. And so the point of doing child fatality reviews is to identify those other opportunities. And again, not to blame the parent who did something wrong. We all do things wrong, but let's find a way to make it easier for the next parent to protect their child and for the community to protect the child. And I do believe mountains can be moved. I proved it to you in my first slide. And just a few final points. I think to remind you that it's really important to listen and learn what's going on in your community. Use the data provided to you about the child fatality issues in your county and your community. Listen to what people have to say. Listen to their ideas. No idea is too dumb to be listened to. And keep an open mind about it. But then focus on what can be changed. And I would encourage you to take a long-term perspective. Change takes time. And the older I get, the easier it is to recognize that change takes time, but it does happen. I have a colleague who worked on one issue, fire-safe cigarettes, self-extinguishing fire-safe cigarettes, for 30 years. But he was successful going from community to community, state to state, and was successful in that enterprise, and children's lives are being saved today because he didn't give up. So I want to encourage you to be patient with the change process, but impatient about continuing to work on it. And I think it's important, as I've asked you to do in several places in this presentation, is to challenge your assumptions. Challenge the assumptions of each other, and especially your own. Are you assuming certain kinds of parents are just bad parents and there's nothing you can do about it and you just need to lock them up and throw the key away? Or are there things that can be done? And evaluate and listen to the results, and don't be afraid to change when something doesn't go well. And finally, to remember, as these pictorial examples show, teamwork, whether it's building a barn, a quilting bee, or being a member of a crew team, teamwork works. And so if you can all work together and get focused on the end point, which is saving children's lives, I think you and all of us together can make a big difference in the state. And there are tools to help you think further about this, and that's what we're going to focus on in the upcoming workshops that will be starting in May, and we'll give you more concrete tools to think through this process and work in your community to do that. But we wanted this to be an introduction so that coming into those workshops, everybody's kind of on an even keel and has these fundamentals under their belt. Some that are very familiar to some of you who have been in public health a long time, and some that may be newer to others. So we're now open to questions. So you can see pictures of my grandchildren and send questions through the chat mechanism, and I'm hearing that there are some coming in. I'll go off the picture of my grandchildren for just a moment to put up also a slide with some resources for you that may be helpful. And again, I know you don't want to write all of this down right now, but we've put together a number of links to resources, and this will be in the presentation that's going to be archived on our website. So back to discussion. Are there questions or comments from anyone?
This time we don't have any questions
not
yet,
coming in yet.
Let's give people a minute. If they want to ask any questions, just type it into the chat box.
And that includes the folks at CDPHE. If you would like to say any more about the upcoming workshops while people are thinking and forming their questions, this would be a good time to do that as well.
No questions? Maybe we should wrap up.
We'll wait another moment. Put this back on. I'm going to remind you here at the bottom, ucdenver.edu/Piper is where the talk will be archived. That's our Piper program website. And then these are other references. I'll just give you a little bit of background since we have a moment. The Children's Safety Network is a national organization that has very good resources on a wide range of injury issues. And they also have resources for doing economic analyses. So if you need to prove to a legislative committee or a board of county commissioners that something is cost effective to do, like giving out car seats or smoke alarms, they have the data to help you do that, where you can plug in your own information and make that argument. Safe States Alliance is the group of mostly health department professionals who deal with injury and violence from across the country. They have many, many resources on their website, as does the National Center for Injury Prevention and Control at CDC, the National Center for the Review and Prevention of Child Deaths, the National Association of City and County Health Officers, the Prevention Institute in California has a wealth of information on their website, and the University of Kansas Community Toolbox has lots of resources and a lot of how-tos on how to make some of these changes at a community level. And then locally, of course, is CDPHE with many resources, including data. At their website, the Kemp Center here on our campus, which focuses on child abuse, has a wealth of expertise and training opportunities, and our Piper program, where I'm located. So we welcome all of you to use those references and to be in touch. Have any questions come in?
Back over to CDPHE.
So I'll turn it back to CDPHE to wrap up.
Yeah, so I noticed that there was a question that came in around the time and location for the Fort Morgan training, and I just wanted to let everybody know that we will be sending out information about registration and specifics about the locations and times for all of the trainings to the local team coordinators next week. This information will include kind of instructions on how to register, who to recruit to attend the trainings, as well as the time and locations. We do plan on the trainings being one full day each. So probably, from morning 8:30 or 9 until about 4 or 4:30, and we'll include meals as well. So we are hoping that that the coordinators will help us with recruiting champions from their teams, and we'll be providing specific information about how many members they can invite to each training. So keep an eye out for that if you're a coordinator.
And we also want to encourage you to take a moment to share your feedback about the webinar through a very brief online survey at this link. We would greatly appreciate your feedback so that we can continue to improve how we deliver these messages to others. Thank you. I've enjoyed being with you today and hope it's been useful to you.
Thank you, Carol.